All right. Welcome, folks. That was an amazing video. This is an amazing place. I'm still astounded by how far this place has come from being a mothballed white elephant complex to a metro burg. So welcome to the Future Forum. This is our Health Tech Conference portion of the day. My name is James Barud, as most of you know, and I lead the Tech Council. And I want to thank our great hosts, Ralph Zucker, who's the transformative leader of the Metro Burg of Bellworks, and the amazing Garibaldi family that's helped him along the way. And I want to thank all of you, our sponsors, our exhibitors, for taking the time out of your busy schedules to join us today. So many of you aren't just talking about the problems of the healthcare system and that faces greater stresses every day. You're finding new ways to actually solve these problems. Wouldn't it be great if everyone sort of acted that way? But that's what technology does best. It solves problems so people can live better lives. It sounds simple. But to do it, you need to overcome daunting and haunting challenges. It's hard stuff, but that's what you want to do. It's also why you were here today, to meet others facing the same challenges, to learn, commiserate, simply build relationships and your business. And to help this healthcare system, and to help be more successful. Of course, the Tech Council has 100 programs every year, and you guys are doing that, essentially learning, networking, building your businesses or your careers. We've been doing it for the past 22 years. Okay, so enough of that. Let me introduce Bud Bauman, who is one of the key folks and one of the best managed and most innovative insurance companies in the country, Horizon Blue Cross Blue Shield of New Jersey, and also our signature sponsor today. I'm glad to call Bud up. He's responsible for managing the IT business relationships throughout Horizon and responsible for how IT engages with and creates value in the business and technology communities. Well, more importantly, he's a fellow alum from Rutgers. So please join me in welcoming Bud to the stage.
Thank you, James. Horizon Blue Cross Blue Shield of New Jersey is pleased to sponsor the Future Forum and Health Tech Conference. This is our third year as a sponsor. Horizon Blue Cross Blue Shield of New Jersey is the state's largest and oldest insurance company. We serve over 3.8 million members who provide a wide array of health, dental, and prescription services. And we're leading the transformation of healthcare in New Jersey by working with doctors and hospitals to deliver innovative, patient-centered programs that reward the quality, not necessarily the quantity, of care that patients receive. On the technology side, Horizon Blue Cross Blue Shield of New Jersey is making key investments in a lot of strategic areas. For delivering member-centric healthcare, we are highly focused on implementing digital solutions that improve our member portal, that provide mobile apps for access to care through nurse chat and telemedicine capabilities, all powered by a digital integration layer and cloud services. In support of our healthcare value transformation, we have been building out capability to deliver a 360-degree longitudinal patient record, combining clinical data with our claims information, and also delivering on population health management services. And as we continue to stay focused on our business systems and our operational transformation, we're looking to implement a new ERP, a new customer service platform, and underwriting and service engines. All this helps us make us more efficient and effective in delivering business services to our partners. It's always fun to be in technology. There's a lot of changes every day, not just every year. And I'm very excited to be here and introduce our next speaker. Stuart McGuigan is VP and CIO of Johnson & Johnson. Stuart has been responsible for global responsibility for information technology and strategy operations. Working closely with business leadership, he is responsible for accelerating the pace of technology innovation, for enabling patients, providers, and consumers, delivering key business improvement programs, and delivering overall technology effectiveness. He's essentially helped architect the technology transformation at the world's largest healthcare company. No small task. Stuart joined Johnson & Johnson in April of 2012, Prior to joining Johnson & Johnson, Stuart was Chief Information Officer and Senior Vice President for CVS Caremark, the largest pharmacy healthcare provider in the United States. We appreciate Stuart taking time to speak with us today. I suspect that he's here because he has some important insights to share with us. So without further ado, please join me in welcoming Stuart.
All right, we are going to have a little fireside chat here. And while we sit down, last night, Stuart was elected to the Hall of Fame for corporate CIOs. I know he's very bashful, but I just wanted to let you know that we are really fortunate to be with, I don't know, one in maybe 100 million.
1,000.
100 million? I mean, how many top CEOs, CIOs are there who run the largest healthcare company on the planet?
Lots of us.
I think there's only one.
Don't believe your own press. My boss made me do it. I just want to start out, first of all, I'm thrilled to talk to my colleagues locally, and I did get stopped when I was getting coffee, and what happened to me was in a particularly tough budget meeting, and yes, but being a CIO, I'm hard-headed. And if there's any promotion, no, this wasn't a workplace slip and fall. And also, I'm thrilled to be introduced by Bud. I was at Merck Medco Health Solutions for 10 years, and Horizon was, I think, arguably the most challenging customer in terms of pushing the envelope. And whenever we'd have a customer visit, it was with excitement and a little bit of fear and trepidation because we knew they were going to hold us to a very high standard. So it's great to see that tradition continue.
Great. Well, thank you for being here. And we appreciate you taking the time out of your impossibly busy schedule. So we just learned that you're in the Hall of Fame. Give us a sort of snapshot about your professional journey, because it's really one of a kind.
Yeah, no, and I think that's true for all of us. I can make it sound like it makes sense retrospectively, but I can tell you moving forward, I had no idea what I was going to do next. I had a lot of good fortune. One of the most fortunate things was at the beginning of my career in graduate school, and then my first job at Honeywell, I worked in AI. I got exposed to machine learning, statistical modeling, what we now call big data, and it was part of experience one of the early AI winters, which I hope to not experience again. And so now that that was kind of a weird background, and now it turns out to be very valuable. Met my future wife, who for some reason wanted me to actually have a career and stop being a researcher and a student. And I went to work in a business role, which the purpose of which was to try to see how we could organize data to make better business decisions. And the focus was on collecting the data. This was the pharmaceutical industry. I was at Merck. And for the first time, we had doctor-level prescription data, which was just like a golden age. And being a modeler or analytical person, what did I complain about? I complained about data quality. Why don't we have the data we need? What were we thinking when we built our systems and not producing the right data? And at a well-run company, if you complain loudly and long enough, what happens? You get asked to fix it, right? So I moved out of the job where I was doing all this fun analytics into doing IT strategy and planning. And then even in those days, and this is the early 90s, it was clear that value in healthcare was going to move to the consumer. So being a pharmaceutical company, we were pretty far removed from the consumer, and a little bit worried about that. And there was talk about the government taking over healthcare as a payer. This was the Hillary era when Clinton was president, and so did something crazy. We bought a company called Medco, which at the time was a $3 billion revenue company, and then over 10 years got to be $30 billion. And guess what? Technology was the product. And so moving up there, I moved formally into the technology organization because we built stuff for customers. That's where stuff got built. Company spun out, and suddenly you're in the same office but working for a different company. Well, you might as well pick your company. That's when I went to Liberty Mutual to help that company move to real time. Insurance has been very much a batch business, but now people are getting car insurance online. And Geico was killing companies that are taking business away that hadn't made that change. That CEO retired, announced his retirement, so I went to CVS Caremark. And the thing that was so valuable there was how real-time the business was and how many people you touched. We counted contact with 4 million patients a day at that point. And we were disparate businesses, specialty, PBM, retail, disease management, and others. And so part of the technology journey was creating a data layer and some intelligence that could look across all the different lines of businesses, not compromise privacy, but make some inferences about what you might do to help a patient. So the first thing we built was the ability to recognize when a patient was in the pharmacy and had just given us their first diabetes prescription. And to take that important moment in care, recognize the opportunity, and then have the pharmacist be prompted for a dialogue with that patient. So that was critical. And then this is going to sound like a theme. The CEO I went to work with announced his retirement. I'm like death to CEOs, right? I don't lead with that when I interview, by the way. And so I got a call to talk to Johnson & Johnson, and that was kind of the last company I thought I'd work for or last industry, because technology had been in the back office, and there I was in a business where it really was critical to taking care of patients. But first I asked about the CEO, and there was a new one. Okay, good. How long do they last? 10 years or more, great. And then talking to Alex Skorsky, our CEO, just visionary in terms of the use of technology in terms of transforming healthcare and the role that a product company could play in providing information, providing care, and then participating in the healthcare system to say, what are the outcomes? And shifting to value rather than unit cost, and that's really been the journey. There was a fair amount of technical work to do along the way to get us organized. We had to restructure all of our infrastructure. We were a little bit legacy, had a fair amount of technical debt. I don't know if anyone else ever has technical debt. Completely current, all in, great. We weren't, so we decided to leapfrog, which in 2012 was a little bolder than it sounds now, to hybrid cloud. And as of my last board report, which was pretty recent, 90% of our computing workloads are in our hybrid cloud environment, which is just, I wish I could take personal credit for that. It was really the technology team that delivered that. But it positions us to be a very different kind of company. So, I can tell the story in a way that makes sense retrospectively. I can tell you on a go-forward basis. I had no idea what was going to come next. But if I had one theme, it was, am I brave enough to consider something that might be risky, but could have a high payoff, and where I felt that I could personally, potentially contribute to something big. And that's sort of been the thing for me.
Well, clearly it's worked. Technology has worked in that respect. You guys have been very successful. But I've been saying, and people have been saying, that technology is really what's going to transform healthcare to make it better, significantly better, and more efficient and cheaper. Why hasn't that happened?
I mean, there's a whole lot of reasons, and I think the U.S. is probably one of the most challenging cases because, unlike almost every other decision, where the person deciding on a product, so if I have a headache and I go into CVS and I look at the pain medications there, of course I'm going to be trying to decide between Motrin and Tylenol. I mean, that's a given, right? They're J.J. drugs. Just saying. And I'm looking and I'm like, do I want a gel cap or a tablet? The gel caps look pretty cool. I'm not sure why, but and then do I buy a 50, a 25? Do I get a big thing and bring it home? And I'm the one who's making the decision. I'm the one who's paying for it. I'm the one who's consuming it. I'm the one judging whether I made all those trade-offs. And that's true for almost everything else. When I decided on a cloud provider, we are the ones who are looking at all the attributes, cost, quality. Healthcare, that's not the case. So if my headache was bad enough and I went to the doctor, which is a lovely experience, right? If you're not going to a minute clinic. No one looks forward to going to the doctor's office or the hospital. So one, not a great experience. I'm not picking the product. I'm not paying for the product in any way that's very clear of what I'm paying for and what it costs, right? There's co-pays and co-insurance and other things and deductibles, but choosing that product is not very clear. So someone else is deciding, someone else is paying, and then with a pharmaceutical, I could show up at the pharmacy or send it into mail service, and then at the last minute, a pharmacist makes a phone call and I get a different product. So if you think about it, even if I gather all the data around that transaction, which stakeholder do I care about? I would say we should care about the patient. But that's the one who's least involved, and that's the one who we have the least data about. So I think the problem is it's a fragmentation of stakeholders. What function are you optimizing when you're trying to optimize the healthcare system? It's not clear. And then what you really want to know is, we make the world's best knees and hips. And there's actually data to demonstrate that. I'm not just being a marketer. I'm not a marketer. I'm not a great marketer at all. But let's just say that's true. What we really want to know is, after you get your replacement knees, what's your life like after that? How active are you? How much function have you recovered? Are you better? Where does that data come from? We don't have that data. We have claims data. We have cost data. We're trying to gather sensor data, but it's actually pretty primitive right now. So the most important function we're trying to optimize, which is quality of care, we have the least data. That's one of the things that makes it hard. But that's one of the things that also makes it exciting. If we can start to crack that nut, gather data, and be able to have that as the basis for decision making, then we can all get on the same page. And instead of being, a product company, when I was just visiting my friends at Providence Health, one of the largest hospital systems, and they have a point of view on us, which is our products cost a lot, and they're struggling with their margins. If we're all trying to optimize the same thing, then a lot of the tension goes out of the healthcare system. We can all focus on solving the same problem.
So, we know cybersecurity is a big issue, and I was going to ask you what keeps you up at night. That's got to be. And I think you guys have done a really good job. Like, you can tell us more, but is that one of the things that worries you?
So I have a policy: never brag about cybersecurity. I'll be in the news tomorrow, and you're like, "Oh yeah, guy, you sounded so confident. Look what happened." And I have colleagues that I know are tremendous technology leaders working for great organizations that have been hit. And the difference between what they do and we do is some of it's the twists of fortune. So yes, that is something that I think it's important to adopt a paranoid attitude, right? So always looking at what's going on. So I do spend a lot of time thinking about that. But then in the future of the world, security is one thing. Reliability, can you continue to make your products? But I think a bigger, broader issue is privacy. So do people feel confident that their data is being used in a way that they would want it to be used, and that it's confidential? And there's some interesting dynamics going on. Some I think are healthy. For my parents' generation, if you had cancer, there was a certain amount of shame around it. You called it the C word. I mean, you whisper, "Oh, there's cancer." It's like it's your fault. Okay, we're beyond that, right? It's something that people talk about. But I look at my kids who are in their 20s. They're really removing shame from having a healthcare condition. My son broke his nose. He got it fixed, and he had bandages, and it was all bloody. And what's the first thing he did? Post it on Instagram. And his mother and I were like, "Get that? What are you doing?" He's like, "No, people want to see." So think about that. It's an inadvertent consequence of our privacy concerns. And believe me, I've been in the business of trying to protect people's confidential data, and it's absolutely the person's right to have that be private. But think of what privacy zealots tell you. That data that indicates what your condition is, that you're so ashamed of, don't worry. No one will ever know that shameful thing about you that you have diabetes, or that shameful thing about you that you have cardiovascular disease. So we're kind of sending a funny message about privacy, which is you shouldn't let people know. It would be horrible if your data was released, but it really, is that the right attitude we should have? Now, it needs to be in the hands of patients and consumers. And so I think a future opportunity where we stop worrying about privacy because the patient, the person, the consumer, and the people are more than just patients, right? They have lives. They're deciding to contribute their data to pools of data of people who have similar concerns, people like them. And then we can start to apply some of the machinery of things like machine learning and figure out what's the best thing for you in all the things you're facing, not just diabetes, but all the things that you're dealing with, and use the intelligence of data to do that for your benefit. But it's got to be in your control, and it's got to be at your discretion. And if we get to that point, then I think it's not so much privacy, although if you want privacy, you can have it. It's about utility. Are you getting value for participating in the healthcare system and sharing your data? And so that's one of our missions. We can think about, we want to set up databases and own the patient, and I've been part of organizations that think that way. I think that's a bad path. I think no one should own the patient. The patients should own the patients. And we should foster an environment that allows for the free flow of information. So if we have a product and it adds value, great. If it doesn't, then we shouldn't have a product.
Fascinating. I never thought of the selfie generation. And
oh yeah, no, it's going to be very different.
Impact on healthcare.
Yeah.
Anyway, we have about 10 more minutes. Let's take some quick questions. Just spit them out and I'll repeat them if I can.
No bad questions.
Anybody who's on the side, just a bunch of people, just try to be seated. Just come on down. Okay. Oh my God. Angelina, one of the top reporters in the state, is in the front row. She's raising her hand. All right.
This feels like a setup.
Don't set it up.
No, it's not. You just mentioned the selfie generation. You mentioned the diseases or health issues as a problem with the privacy. I don't think that that's it though. I'm curious to know about what your thoughts are on the fact that we may be in a generation that will share their issues, but not their personal, like their social security number or their credit card information. I think, or their address. I think that's the data that people are most worried about getting out there.
Yeah, no, I agree. But if you look at HIPAA specifies just knowing that you are a patient in the system is private, right? And so I totally agree. And having at CVS, we were one of the larger processors of credit cards. So it was Fortress, Mode, Dragons, alligators, and all those things. And and people don't want to share that. They shouldn't because of the harm that can be done by people who have used that kind of information. I'm thinking more of, if I have epilepsy, should that be something you're ashamed of? And should there be negative consequences to that being known? Now, it should be purely at your discretion how you share that. But imagine if you're young parents of a child who has autism. Wouldn't it be great to feel you could join a community of people of size and scale who are contributing information, that have researchers that are working with those populations, so you can find out up to the minute the very best thing you can do. Not something that was published a year ago, that was researched 2 years ago, that was a bright idea 3 years ago, but in what's called empirically based medicine. Just near real time, what is the absolute best thing for you right now based on patients like you or providers or parents like you? What an amazing thing that'd be to be part of that. And the social contract is that that's the purpose that the data gets used for. And so there has to be protection around it. So I think if we can show that there's enormous value to participating there, then people will want to be part of that. And we won't be able to stop them. But if they think there's risk and they're being used in some other way, then I think we're in sort of the Facebook zone.
You're not following up. Anne, quick question. Make it quick.
You said it, patients like me.
Yes.
That's a site,
That's a thing, yes.
Precisely
Yes.
what you're saying.
I meant that with lower caps, though. No trademark
Patients
disputes.
like me, right. And so, when I go into into a pharma company and I even say that word, you can feel people cringing because of the disclosures that people make about, all off-label use or
Right.
negative indicators. So I'm wondering about that, because I agree with you, obviously, from a patient point of view, but how do you see that from a pharma company?
So if you're not familiar with the pharmaceutical business, it is the most regulated industry that I know of. Not just the drugs and their safety, which of course, but every word you say has to be approved by the FDA and has to tie to your labeling. You can't use an or if an and is in the language. So, you know, any piece of advertising, any piece of material is reviewed by the FDA, and it is tightly coupled. And so what we can say and do is highly restricted. What a doctor can say and do is not. They're professionals. They're the what we call the learned intermediary. They read the literature, they look at science publications, they make their decisions. Well, we can tell them highly regulated. What we can tell patients even more highly regulated. What physicians can do is not. So what I'm talking about is not us as a pharmaceutical company changing that, because that's not going to change in the short term, is helping the healthcare system, someone like Horizon or a hospital system like Princeton, be able to have the resources to be able to collect the data to inform their providers what the data tells them is the best thing to do for this patient. It's patient, it's provider, it's data, it's not us. But we can help foster an environment that allows those kinds of things to thrive. But we are always extremely separated from that and highly regulated. You know, we're working with the FDA on a very interesting project that's called pre-certification, and we're the only pharmaceutical medical device company that's in that group. The rest are the usual technology giants. And the FDA is being very forward-thinking. And think of a medical device software as a service or a product. They don't want to be in the way of innovation, so they're working to figure out how can they pre-certify that the software that helps patients is built in the right way and does the right things and has all the protections. I think that's incredibly forward-thinking. They're trying to think about how do they work with machine learning and data science models. Is it going to be a black box, or does it have to be explainable? And how do they not get in the way of innovation and improvements in patient care, but also protect all of us? So I don't envy what they have to do. I think it's a tremendous challenge, but we can together as all the different participants in the healthcare system be very constructive in how we support that progress.
All right, a couple more questions. Michelle Noren is the CIO of a small university called Rutgers.
I drive through it on a daily basis.
She has a question, and
could you stagger when you start your semester? Just saying. More confused students and parents looking out their window. It's an extra 20 minutes to work, but I'm not really complaining. But I am.
So I have maybe more of a philosophical question. Your perspective about patients and the role that we all play as patients in our care and our information. What do you think will be the tipping point to the circumstance that you described, where I do have a little bit more control over my information, how it's used, what I choose to be public or not. Today, we've got information all over the place, and there's so much red tape in a way in terms of the disclosures I sign and how I get my information and even who to ask to get information. Technology can be a disrupting factor in these industries. What do you think will be that tipping point? Maybe it's a little bit too predictive.
No.
There's got to be a moment in here where technology will create that tip toward the patient versus right now where it's completely, in my view, controlled by the industry itself and the companies who own the data. What do you think?
So disclaimer, I said earlier on that I was an early researcher in AI and I've always kind of kept a hand in. So that means I've been wrong sequentially for a long period of time. just saying. I think the tipping point is coming from a variety of factors. One is the increasing visibility of the cost, and the out-of-pocket cost is driving people to care more. when all you paid was $2 copay, no matter what drug you get, did you care one was $10, one was $100? No, you cared about what did the doctor want you to take. As you start to pay more and more of that, you start to care more and more about the difference. That's one factor. The other factor is, it wasn't too many years ago that EHR, EMR data were relatively the exception, not the norm. And so it's messy, there's a mass of it, you got armies of people trying to code the notes to try to make it into data. But that's happening. And the thing about healthcare that makes it a little more of a challenge is just the time frame. So if you think about a treatment, what is the best outcome for a treatment of a serious disease?
Cure.
You didn't die. You're still alive. How long does it take to prove you didn't die? Hopefully a long time, right? So to test outcomes where one therapy gives you, a cancer survivor 10 years instead of 5 years, takes 10 years. And more than 10 years because you're collecting a lot of data. So I think as we get more data that has more surrogate outcomes, and you can go into a doctor visit really well informed. Right now it's Dr. Google, and we make fun of that, but you didn't have anything like that before. And so, that's really changed the dynamic. So I have this image of my, 82-year-old mother with her iPhone, and she's a big iPhone user, turning it on, and if you knew her, this would be really funny because she's a character. In the doctor's office saying, "Doctor, what should I do now?" And he starts to talk, and the iPhone says, "Well, that recommendation empirically is not the best one." And she goes, "See, I told you." And when that starts to be part of the experience where the patient is armed with as good or better technology than the doctor, it's going to be a very different conversation. And I think doctors will be under less pressure to be omniscient and perfectly correct, and more in this is the best thing, among the options, given the likelihood of helping you, not, you have to get a new knee and there's no other choices. There's always a range of choices. And so I think tipping point is exactly the right words to use, because it's not going to be this gradual, it's going to seem very flat, although if you look closely, it is accelerating, and then at some point it's going to take off and the whole system will flip. That's my belief. When, like I said, I was an AI researcher, so I've been wrong a lot on the when. I think I've been really good on the what, but the when, we'll have to see.
All right, well, thank you. With those, I'm sorry, we ran late and we're running late. And now I just want to thank Stuart for coming here today and, again, taking the time out of his incredibly busy schedule to be here. I hope he'll stick around for a few minutes, so if anyone has questions, they can follow him out into the hallway there. And this sort of sets the stage for the rest of the morning, where we'll have a panel to really talk more about how companies are really addressing and leveraging technology to make healthcare better for all of us. So, and I'm delighted, again, that Stuart is here. I've heard great things about him. I've heard he's a good guy, a nice guy, a Hall of Famer guy, and he's our neighbor in New Brunswick. So I'm just, again, really delighted he came, and thank you again for taking the time.
Thank you for the opportunity.